Let's look now at what your future coverage will consist of. First of all, let's talk about what's not changing, and that's the center of this diagram. That's your primary coverage, Medicare Part A and B. If you do not have Medicare Part B, now is the time to enroll because you only have until March 31st to enroll in that for this upcoming year, and that would be then effective on July 1st. For those of you who might not have Medicare Part A, you need to contact PEB because you will have some other options available. So that part is not changing. You've been using your Medicare Part A and B under the coverage you've had through PEB. What will be changing is that bright blue band, the additional coverage that wraps around it. And that's going to be either a Medicare Advantage plan with prescription drugs, again called an MAPD, or a Medigap plan plus a prescription drug plan. Then for those of you who are interested, we will have optional coverage of dental and or vision. And if you're interested in those, please mention that to your benefit advisor as you speak with them. Let's then look at some individual Medicare plans in the state of Nevada. And I will go fairly quickly through this because we have quite a few. But you can always get more questions answered by speaking with your benefit advisor or by just pausing this presentation to look at the chart that's up. Now, what choices are available in Las Vegas? Well, first of all, under the Medicare Advantage plans, there are 10 different ones available. They range with monthly premiums from $0 to $116 per month. And on the right, you can see the different companies that offer these plans in the Las Vegas area. Under the Medigap or Medicare Supplement, and please understand that those are the same thing. It's just like calling an automobile a car. A Medigap is a Medicare Supplement. There are 8 different Medigap plans available from $69 to $203 per month. And then under the Part D or prescription drug plans, again, those are the same thing. Under the prescription drug plans, there are 18 available from $15 to $121 per month. Now, in the entire state of Nevada, we have 2 different plans available, a vision and a dental plan that are optional. The vision plan is from VSP or Vision Service Plan, $14 per month. It's actually paid in one lump sum of $168. That entitles you to an annual eye exam with a $15 copay, and then it does have coverage for having new eyeglasses, lenses, and frames made. Under the dental side, Extend Health offers one plan in Nevada from Renaissance Dental. It's $50 per person per month. It has a $0 deductible and a $1,600 annual maximum benefit available to you. Note that there is a PEB plan that will remain available, but the details are not yet available, so it is to be determined. Now, let's look at some more specific plans for Las Vegas, and then we'll move on to the rest of the state. Under the Health Plan of Nevada, which is a Medicare Advantage plan with prescription drug, there on the left-hand side, the premium is $0 per month. It has a $0 deductible. If you go to see your primary care physician, it's a $5 copay. To see a specialist, a $25 copay. If you were admitted to the hospital, you would have a $125 copay per day, days 1 through 7. After 7, then there's no copay. The prescription drugs, you see the different tiers of the costs of copay. The most common generics are $6 for a 30-day supply. The next is $38 for brand name drugs, $92 for non-preferred brand drugs, and 33% coinsurance for a specialty drug. Now, almost all of the plans that we offer under the exchange at Extend Health do have availability of mail order to get a 90-day supply, and in most cases, that will give you some discount as well from those. And if you're interested in a 90-day supply mail order, please mention that to your benefit advisor. Under these Medicare Advantage plans, I've listed that they have some dental, hearing, and vision benefits, but please be aware that under most of them, especially the lower priced ones or $0, it's not going to be very substantial coverage. It will be something simple like a new pair of lenses for your glasses after cataract surgery or something like that. Now, under all of these plans, all Medicare plans, because of the health care reform that was passed in Congress in early 2010, none of the plans have a lifetime maximum. So you do not have to worry about the horror stories that you've heard from people in the past about reaching a lifetime maximum. There is not one. Under the health plan of Nevada, you do also have a $3,200 out of pocket maximum in a plan year. The next plan is a Humana HMO at $81 per month. You see the copays, they're very similar, and then the prescription drug copays. This one has a $4,000 out of pocket maximum in a plan year. Then on the right-hand side, Mutual of Omaha Plan F combined with a Humana prescription drug plan as an example. The thing to know about a Medigap Plan F or any Medigap plan is it is exactly the same coverage anywhere in the country because that is mandated by Medicare. The insurance companies must conform to that. So we're going to look for the one that is the least expensive in your area because the coverage is the same. In Clark County, that would be the Mutual of Omaha Plan F at $169.08, and that's based on a 75-year-old male because Medigap plans are based on age and gender. Then the prescription drug plan that I'm showing there is $38.02 monthly. The difference with a Medigap plan, especially Plan F, is that you have no copays, as you see. If you go to the doctor or the hospital or the emergency room, it is 100% covered. Under this Humana drug plan, you see again there the levels of the copays for your prescription drugs, and again, no lifetime maximum. Then let's look at Northern Nevada. In Carson City, there are two different Medicare Advantage plans available from $0 to $171 a month. Under the Medigaps, 13 different from $76 to $226, and under the Part D or prescription drug plans, 16 different plans available, 6 different carriers from $14 to $121 per month. And if you look down there, you'll see that is the same in Reno and out in the non-metro areas or the more rural areas of the state as well. In Reno, there are 3 different Medicare Advantage plans available. Again, 13 different Medigap plans, and that's going to be the same everywhere in the state as well as far as the rural areas. Then in the non-metro areas, there are 3 different Medicare Advantage plans available. Again, $0 to $171 per person per month. Let's look at more specific for Reno. First of all, the Humana Choice Plan is a PPO, has a premium of $61 per month, and if you can see the copays there. This one's a little different under the hospital stay in that it is a flat $550 per stay copay. That does not matter whether you're in the hospital for 1 day or 30 days, it would be the $550. Again, looking on down, you see the copays for the prescription drugs, and again, some dental, hearing, and vision available under both of these Medicare Advantage plans. The Humana has a $3,400 out-of-pocket maximum in a year. The Anthem Blue Cross Blue Shield of Nevada, which is in the middle, is a $0 premium per month. It has a $0 deductible, and it has a $0 copay to go and see your primary care physician. If you were to see a specialist, then it's a $40 copay, And if you were to go into the hospital, it's a $268 copay per day, days 1 through 6. A $6,000 maximum out-of-pocket limit under that plan. Then on the right-hand side, Mutual of Omaha, Plan F, and I've combined that with a different prescription drug plan in this example, which is $14.80. Again, under the Plan F, there is no copay to see the doctor or a specialist or even to be admitted into the hospital. Under that prescription drug plan, it's a bit different in that it has only 3 tiers of prescription drugs. The most common inexpensive generics have only a $2 copay if you're using a preferred provider under that plan. The next tier is a 20% coinsurance, and then the top drugs are a 35% coinsurance. This plan does have a $310 deductible, but the Plan F has some foreign travel coverage as well. Again, no lifetime maximums under any of those. Then in Carson City, we'll look at the Sierra Nevada Spectrum plan. Premium is $0 per month. Deductible is 0. You see that under the prescriptions under that plan on the left that it actually has 5 different tiers. Most plans have 4. Some are 3, some are 5. This one has 5. The most common inexpensive generics are $4. There are some other generics called non-preferred generics that are $5 for a 1-month supply. And then on up through $45 for the preferred brand, $95 for the non-preferred, and 33% for specialty drugs. $4,250 out-of-pocket maximum in a plan year. The Humana Gold Choice in the center is a PFFS. That stands for Private Fee-for-Service Plan. And that very often works nicely in rural areas because a doctor can just choose to accept that one plan and you would have coverage with your doctor under that, so there's not a network. You see the copays there below. The prescription drug plan under that Humana plan does work a bit differently. It's a flat 25% coinsurance regardless of the cost of the drug. So if a drug's true retail price is $100, for example, you would pay 25% or $25 as a copay. That Humana plan has a $5,000 out-of-pocket maximum. Then the Mutual of Omaha Plan F and the Humana prescription drug plan remain exactly the same as in our previous example.